And I'm going to put it in historical context. So some people will get mad, and I think that's okay.
What's up, everybody? I am your host, Keisha from Put Your Phone Down podcast, and I have a special guest right now who is going to inform us about all the things you need to know. I plan on asking Dr. Padda about lupus, about fibromyalgia, about diabetes, and this is the perfect one to ask for something like this. It is very important that we get educated about these autoimmune diseases, and we just had an awesome conversation. I will not hold anybody any longer. I have Dr. Padda on the podcast who is going to explain to us. He has over 30 years experience in what he does. Welcome to Put Your Phone Down podcast, Dr. Padda.
Thank you. I appreciate it.
You're very welcome. So I know we spoke about, just different things. And I know you said, Keisha, I would like to basically speak about your background and the African-American community. I want to put a disclaimer. This is not at all just for African-Americans. I want it to be for everybody who can get something out of it. But by me being African-American, I want to speak to my community. So can you please give us some background on what made you get into this healing business? That's basically what it is.
Yeah, so as you can tell, I'm not from the U.S. I grew up in India. I speak American Midwestern English, but I grew up in India. And I grew up in India at a time right after India partitioned with Pakistan. And hundreds of thousands of people were killed in that transition period when India separated from Pakistan. This was after the Brits left. My family relocated to the U.S. because India was becoming communist, and we were rapidly descending into communism. And we didn't want to be in a communist state. So we came to the United States. My father's a physicist, my mother's a mathematician, and I grew up in St. Louis City after the age of 8 or 9. And I grew up in downtown St. Louis City in the projects. I grew up in a place called leaky town. I didn't know that there were white people in the United States. I hadn't met any at first because all I saw were other kids. Now, I happened to be brown and they happened to be a little bit darker. I happened to have a turban and I couldn't speak English, and they spoke fluent English. But I didn't know that there were, it was only on television that I realized there was a whole other population of people, because I grew up watching Sanford and Sons, and I grew up basically in Laclede Town. Now, eventually we moved out of Laclede Town and I ended up completing my education in the county, and that's the first time I ran across more than 2 white people at a time. So it was odd. I didn't quite grasp it. I'd always loved science. I'd always loved technology, and ended up going in medicine. But I ended up wanting to really give back to my community. And because I was from India and I was a kid and I couldn't speak the language, I spent a lot of time introspecting and being quiet and observing. And it gave me an opportunity to look at people and not just look at them, but see what they were doing. And because I was cross-cultural, I was from India, I was with an African-American population, and then I was with a predominantly white population, and I could see the differences in the communities. And I could see behavioral, and I could see nutritional, and I could see wealth, and I could see shifts in demographics. And it led to some conclusions for me as I grew up. I eventually went to medical school and graduated, and I always wanted to give back to my community. So that I relocated back into the central core of St. Louis, and that's where I've been doing at first anesthesia, then interventional pain, then obesity and addiction. And so I've always tried to help the community that helped me at first when I first moved to the U.S. I think there's some things that we have to recognize, and they're hard truths that have happened. And I think that I want to directly speak to your African American population that is a good chunk of the people that listen to your podcast. And the vegetable oil makes you get terrible ADD, and it makes your brain become impaired over time. In fact, to the point where some of the components of vegetable oil make your oxytocin levels go down, and that's the hormone that makes you bond with your baby. And so the more vegetable oil you have, the less bonding you have to your child, and the less bonding you have to other people, and the more loneliness that you have. You've already separated the husband and the wife, and now you're separating the child from their mother. And all of a sudden, you're feeding them a diet that triggers a dopamine release, and now they're bonded to the food instead of to the people, and you get obesity. And all of a sudden, as you increase the amount of pollutants in the food, you cause leaky gut. And leaky gut triggers autoimmune defects. It causes your intestines to become inflamed. It causes lipopolysaccharide, which is stool material, to go across your gut membrane and end up in your bloodstream, which causes you to trigger lupus. And it causes you to trigger fibromyalgia. It causes you to trigger diabetes. It causes you to trigger arthritis. Fibromyalgia is fundamentally a disorder of metabolism. It's a disorder of essentially pre-diabetes. Secondarily, it has other things. But we know that if you use an anti-diabetic medication, like metformin, it actually turns off fibromyalgia. And we know that the patients who have fibromyalgia have something called insulin resistance. And we also know that they're more likely than not going to become fully diabetic. So what we try to do is we try to, instead giving them narcotics, instead of giving them pain medication, we fix their metabolism first.
So how can we reverse this? You know, a person with lupus or fibromyalgia, they want to pull away from medication. How do we start with it? The reversal, I would think, would be the hardest part.
So we're doing this every day. I mean, you hear about patients that are type 2 diabetics and they're going to be diabetics for life. That's not true. I can tell you the vast majority of type 2 diabetics, we're able to get them off of insulin in 3 or 4 months. We're able to get them to lose weight. If you use your regular standard protocols of going to your doctor and they tell you, look, just eat less and move more, the chances that that succeeds is 1 chance in 167 to 1 chance in 254. If you follow our protocols, your chances are 8 out of 10. And we don't use Ozempic. We don't use Wegovy injectables. We don't use GLPs. The reason why we don't use these drugs for the injectables is because they make you stop eating. And when you stop eating protein. And you lose your muscle mass first before you lose your fat. And then when you get off of the drug, when you got to the right weight, you regain your fat mass, but you never regain your muscle. So you're actually sicker afterwards than you are before because you've lost all your muscle mass. And it takes 6 weeks to recover what 1 week of muscle mass loss does to you. So you have to work out for 6 weeks to regain that 1 week of muscle loss. So we don't use the injectable Ozempics and Mounjaro and those drugs. We change diet instead, and we reverse our patients' diabetes. And we're very specific about how to do that. And we go to almost a near zero carbohydrate diet. We use real food, and we reteach people what real food is.
It links in with the food because, I see it in kids all the time and adults. Adults are now being diagnosed with ADHD. You know, they just spent their whole time going through school, and now all of a sudden, you know, we blame it on getting older, but yeah, it is one of those things where it's like, okay, I can't remember what I just did or what I said, but it all starts with what's in our food.
Yeah, you can't fix a problem where you eat 2 pounds of a food with a capsule that weighs, 1 milligram. 2 kilograms or 1.5 kilograms of food, 1,000 milligrams, 2,000 milligrams of food against 1 milligram of a capsule. How are you going to fix that? You got to fix the food problem. So there's a bigger issue at play here, and that is that the food supply is terribly damaged, and it's been organized for the big food companies to make a ton of money. And the only way they can harvest that money is from people.
Now we're seeing kids that, are, in my opinion, overdeveloped. The young ladies have breasts at 7, the young men are pretty much growing and developing, being husky, as we call it. But they're eating these flaming hot every day, all day.
It's two things. I would tell you that I agree with you as in terms of the earlier maturation of girls, and their age of menstruation is getting young, and they're getting much more mature. But the other thing you're going to notice in girls is they're getting more masculine.
Yeah, aggressive.
And what you're going to notice with boys is they're getting more feminine. And that's not made up. What's happened is it's the microplastics in the amniotic fluid around the baby, and it's parts per billion. And those microplastics are estrogenic. And if you expose girls to estrogenic material when they're in utero, it increases their maturation. And then you combine it with food and other things to make them mature faster. With boys, what it does is, for a population of boys, they may get early huskiness, but they quickly will also become more feminine and more emotional. And there's actually a study on this. It's called the anogenital distance. It's the area of the taint. It's the distance between anus to the bottom of the testicle. It's shrinking over time, and it correlates directly with the amount of microplastics in the amniotic fluid and the feminization of the population. And right now, 20.6% of the population doesn't even know what gender it is because it's feminized. They don't know because they got exposed to estrogens in the uterus, and they don't know. And it's not just the human population. It's the same thing with polar bears. We've measured that anogenital distance on polar bears that eat seals that end up eating microplastics. And we can measure the microplastics in the polar bears. And we know that their anogenital distance is shrinking and their sperm count is decreasing, and they're becoming less massive.
How does that happen? Like, is it the things that the pregnant women are ingesting?
Yeah,
or
it's in the plastic bottles. You're getting microplastics from the plastic bottles.
Okay.
It's contaminating all your food.
Oh my goodness. Okay. I wanted to also touch on, because I know we're getting close to wrapping up, but I wanted to touch on so many things that you mentioned. A lot of people are dealing with migraines these days. Is that connection with the vegetable oils and the different things that we are experiencing with the food?
There is a relationship, but there's a couple different things. It's certainly food related, a component of it. Part of it is genetic, and part of it could just be cervicogenic. It could be from the back of your skull, and it could be damage to the joints in your cervical spine, which trigger occipital neuralgia. And you have to also understand that the more estrogen you have, the more likely you are to have migrainous headaches. And migraine headaches are really a type of seizure disorder inside the brain without having the grand mal seizure. And it also has to do with blood flow and leaky blood vessels in your head. So there's a whole host of things that we do for patients. And we work with those patients to reduce their migraines. It's pretty complicated. The migraine headache is really the tip of the spear. It's one of the more challenging things. We have all kinds of drugs that we can use on them, but our goal is we use the drugs temporarily, and then we fix the underlying lifestyle issue. Because long term, we want people, we don't want people to have to be stuck with a lifetime of medication. We want them to be able to self-manage.
What is it that you would like to leave for the patients that are dealing with the lupus and the fibromyalgia and, diabetes? Is it something that you can give them where they can start now? Like I said, the young lady that submitted the question about, feel safe, heal for 2 years. Is it something that she could notice to stop or start doing immediately? What would you do for these things?
So the first step is a dietary intervention. I would go to one of our websites. It's called www.reversediabetes.md. Totally free. It's got protocols on there, and it's got videos, but it's got protocols that you could follow for dietary intervention. That's step one. And then there's other things that we can do to really make a difference in people's lives. I mean, people have like profound anxiety. They're on anxiolytics. They can't sleep at night. People have PTSDs. 40% of my patient population has PTSDs. PTSD sticks to you longer if you're metabolically dysfunctional. And so if you've had an abuse situation, which the reality is, as human beings, we've all had something that's happened to us that's a terrible thing. Most of us, we just outgrow it and we keep moving forward. But 40% of people don't. And it's really worse if you have neuroinflammation. So what we try to do is calm down that neuroinflammation and change patients' gut health. For example, anxiety and sleep. It's really driven by GABA aminobutyric acid. And it's through the vagus nerve that goes through your neck, and it calms your brain down at night. So we change people's GABA in their gut to change their gut bacteria to calm their vagus nerve down to allow them to sleep better at night. And that's to get them off of the Ambien or whatever sleep aid they're on. So they're all kind of medical protocols, but the goal is to reverse the fundamental underlying disease process and make a big difference there. And to identify early. If you could identify early, you can have a huge difference. Alzheimer's is really type 3 diabetes. It's diabetes of the brain. If I do a genetic test and you're ApoE5 gene positive, homozygous, you have a 95% chance of getting Alzheimer's. And there's a drug that we can use to help you. It's 1% beneficial, and it costs $85,000 a year. Or I can change your diet, and it's 40% beneficial, and it costs nothing. Personally, I would do the 40% because I can get 40% improvement without doing anything else. And if I can avoid getting type 3 diabetes in my brain, I might never get the symptom anyway. And I can save myself $85,000 a year. So, I mean, there's a lot of stuff that we can do. And most of it's just returning people to health, returning to them, turning the clock back and back to where it was 80 years ago on dietary intake. And that's where I want to get people back to health again.
That's the goal. I had no clue it was a diabetes 3. So is it a higher level of diabetes 2? Like does it go 4 or?
No, it's just diabetes type 1 is the traditional childhood diabetes where kids don't produce insulin. Diabetes type 2 is we produce too much insulin and we become insulin resistant. And it's the typical diabetes that we see in adults. But now we're even seeing kids with diabetes type 2. And diabetes type 3 is considered diabetes insulin resistance in the brain. And PCOS is another kind of diabetes. Polycystic is another kind of diabetes variant. Cancer, the majority of cancers are a variant of diabetes. Insulin, it's a growth hormone, it causes the growth of cells. That's what cancer is. So a lot of cancers are associated with being pre-diabetic or diabetic. And so we can calm that down.
So one more thing before, what could be the replacement for vegetable oil? I know some people use peanut oil. What's the replacement to have these people just start something new?
Butter, ghee, whatever you do, stay away from peanut oil. And let me tell you why. When you have peanuts, the first year you grow a peanut in the soil. Well, peanuts aren't nuts. Peanuts are a legume. And they absorb all the nutrient from the soil and everything else in the soil and condense it into this kind of pea that we dry out, and then we crush it up and we extract the oil, or we turn it into peanut butter. But it's not a nut. The next year in that same soil, we typically will plant cotton in that soil, and we'll spray the crap out of the cotton with herbicide and pesticide. The third year, we plant peanuts again. And all of a sudden, we picked up the herbicide pesticide from the cotton from the previous year, and now that's concentrated in the peanut. So now you're eating herbicide pesticide. The 4th year, it's back to cotton. The 5th year, it's back to peanuts. Now you've got double concentrated herbicide pesticide. By 10 generations, you're getting nothing but herbicide pesticide and some oil, and it's vegetable oil. And so it's not what I want you to have. I want you to have, if you're going to have oil, it should be ghee, it should be butter, it could be avocado oil, it could be tallow. We have a whole list. And if you go on reversediabetes.md, it goes through those lists and kind of explains how we came to those conclusions and what we recommend. And it's all free. There's no charge on that site at all.